You're a 54-year-old man. Go to this clinic for lower back pain. Your pain is only getting worse, and this is your 5th visit, and now you barely can walk, and you have stool incontinence. That's poop in your pants. I'll tell you more about it. Hello everyone, this is Dr. Mitch Freeman. I'm a board-certified family physician. I would like to share my experience and knowledge with the rest of the world. So this patient was a 54-year-old man, was working as, that story was like over 20 years ago. And this is the first case that opened my eyes about chronic prostatitis and how bad it can get. This man was, I was working in urgent care. A couple years after my residency training, I was a new doctor. And patient came into this clinic I was working in, and he was seeing the physician assistant in the clinic, and he was being treated for low back pain as a workman's comp injury. And he was getting anti-inflammatory, muscle relaxer, the usual low back pain treatment. And he's only getting worse and worse and worse. And this patient came with severe low back pain, barely can walk, and he was having stool incontinence. And the medical assistant that checked him in, she did not put his chart on the rack because she was afraid that the same physician assistant gonna get it. So she came and handed it to me. She told me, please go fix this guy. I don't know what's wrong with him. He's really bad. So I went there. As a physician, whenever someone have a bad back pain and it get to the point of stool incontinence, you think they have a really bad spinal cord injury to the point that they have now affected their nerves, affected their sphincter tone and sphincter ability, and they're having stool incontinence. So I went and talked to him, confirmed he had back pain and it's been getting worse and he barely can walk. And I went and called the orthopedic on call. And I told him, I have this case. He told me, did you check his sphincter tone? I told him, no, I didn't. He said, can you please check his sphincter tone and report back to me? So, sure. So I go, put my gloves, put KY gel, bend over, let me check his sphincter tone. And his sphincter tone was normal. And as a doctor, if I'm putting my finger there, just finish the full exam. So I put my finger further and barely touched his prostate. And he was screaming from pain. He's like, oh my God, I think I know what's wrong with this guy. His sphincter tone is normal and his prostate was very tender. So I was like, I've never seen that before, but I'm a new doctor. So I told him, I think you have a prostate infection. I called the orthopedic, told him what I think it is. And I gave him, at the time I gave him Cipro, 500 milligram twice a day. He came for a follow-up in a week and he was 100% better. No back pain, no incontinence, and I was a hero. Now, that case, after I had this patient, any patient that says lower stomach pain, lower back pain, I'm checking their prostate. I'm not letting them go without checking their prostate. Because that clinic I was working with, we had a lot of patients that come in workman's comp injury and a lot of low back pain. And a lot of them end up being prostate infection. And believe it or not, I end up getting hated for it because those patients, a lot of them don't have medical insurance. And because they come as a workman's comp injury. And when I diagnose them as a prostate infection, it becomes not workman's comp related, and they don't allow them to go to the clinic, to that particular clinic on a workman's comp case because it's not work related and they have to use their medical insurance or their private funds to treat that condition. And I do get hate for it, but it didn't stop me from diagnosing that case. So years go by and this is an interesting thing. So this is what you would put up with as a doctor. So the medical director comes to me and tell me one day that, hey, the staff is saying that you are checking every patient, every man with a low back pain, you're checking the prostate. What's up with that? You need to cool it off. And I don't know what to respond to him. This medical director, he was a medical doctor. He did not have the training I had. He did not, even though he was a physician that works in the emergency room, but he didn't have any residency training in emergency room or in family practice or in any other specialty except 1 year in psychiatry. So the fact is, he cannot tell me how to practice medicine. I continue to do what I need to do, and I continue diagnose prostatitis and pick all those patients that come in with low back pain, end up being chronic prostatitis, and they get better and they move on with their life. I will be sharing more and more of these cases. I will be telling you stories of my personal experience and the unusual presentation of those chronic prostatitis. I would like to raise awareness for people, patients, doctors, medical students all over the world. Please follow and subscribe, and I will talk to you in the next video for another chronic prostatitis story. Have a good day.